Hello, my listeners. I'm Dr. Ashar Hassan, Manipal Hospital, Broadway, Kolkata. So today we're going to discuss something a very important topic, which is called the GERD or the gastroesophageal reflux disease. Now, this is mainly the symptoms are that you will have some, discomfort or sense of burning sensation in the chest. Number two, there can be some sour or bitter taste in the mouth on and off, mainly after taking food and sometimes also in the empty stomach. The atypical signs are sometimes you may have a chest pain, you may have difficulty in swallowing, or there may be some bad odor coming from your mouth on and off. Now the problem is basically the acid which is there in the stomach and reflux back into the food pipe, that is the esophagus. By God's grace, we have something called the lower esophageal sphincter, which prevents the acid from coming into the esophagus in normal people. But due to some condition, due to a lax LES, due to some other problems of excess body weight, excess intake of alcohol, cigarette smoking, and other pathological conditions, this acid will come back into your food pipe and cause these symptoms. There are a few varieties. The varieties are, number one is the NERD, which is the non-erosive reflux disease, which is the most common. Next is the erosive gastroesophageal reflux disease, and there is also an entity called the nocturnal NERD, where the symptoms are more prominent when you go to bed at night time. Sometimes this may mimic an acute asthma attack. Sometimes it may cause some problem of chest pain. So you have to involve a good medicine doctor who will actually evaluate you, examine you, and do the necessary tests to actually diagnose this very common condition. In the worldwide prevalence, it is the most prevalent disease, especially in the Indian subcontinent, but it is seen all around the globe. The reasons are maybe our dietary habits, our lack of lifestyle changes, our increased body weight, our propensity to eat heavy meals and go immediately to bed at bedtime, our increased intake of spicy and the packaged food. Number four is there may be an increased body weight. So all these symptoms together make Indians more prone to develop these symptoms. The treatment is, number one, do not go to bed immediately after taking food. Maybe walk or lie down, go about walking or do a little brisk walk and then go to bed. Number two, if there are increased body weight, reduce the body weight. This will help you in controlling the lax esophageal sphincter. Number three, there are some other drugs option which you can take, that is the proton pump inhibitors like the pantoprazole, the esomeprazole, and the lansoprazole, which can be taken. If there is very severe disease or there is the nocturnal variety of GERD, which is called the nocturnal variant, you can actually go for a bi-daily dose of 40 milligrams. It can be diagnosed by endoscopy, it can be diagnosed by a PH24 study, and you have to get regular follow-up. Just like to tell you, if it is a chronic condition, this may lead to a development of sometimes a case of Barrett esophagus. Now, this is a dangerous thing because it may lead to a carcinoma of the esophagus in the near future. So be cautious, eat your food properly, chew it, reduce your body weight, have a good lifestyle, and if the symptoms are prevalent, please conduct a good session with your medicine doctor. So thank you. I'm stopping here, and I hope we have learned something new about this very prevalent disease called GERD in the management in day-to-day life. Thank you very much.